everyone, welcome back to another episode of Sonographers in the Cities. I'm Lynn.
And I'm Giselle.
And we hope that you are having a great month, great July, great summer. And thank you so much for taking your time and tuning into this episode or any other episodes. And we really appreciate your time and thank you for taking us along with you on your daily routine.
Yes, happy summer. I mean, I don't know about you, Lynn. I'm having a fun summer, even though I'm still in school and doing my
I can
MBA.
tell.
But like, you're obviously still in school too. Are you having fun at least, or just kind of like really busy with school?
I'm not busy. It's just I'm like slowly checking out.
Oh no, I
If
know.
that makes sense. Like the
No.
senioritis is kicking in. So
It
I'm
makes
just
sense.
waiting for this quarter to end. I have about like 3 weeks left. And then last quarter.
Yay.
And then I would be, it's like kind of end of July. So about 4 months. So I'm
Wow.
done with the program. Yeah.
It's gonna go by fast.
Yeah, and then 3 months until I take the registry. So that's all I'm waiting for.
Yay. That's exciting. Well, I mean, that's literally like for everyone that's been following along on your journey, it's so crazy because you're almost there. There's this song that Jonas Brothers has, and they're like, it'll go by fast, so don't you blink. But it's like your 2 years is going by. It's almost done. It's all literally just gone so quickly. Well, hopefully you're having fun at the same time. I know since you're like towards the end, do you have any advice for those people who are still like starting out or like in their beginning stages, since you're like almost near the finish line?
I was like, since you know how we like talk through every single stage of the whole process being a sonography student or becoming a sonography student, there's just many, I don't want to say a phase, but like different parts of it. Yeah. So for those of you who are waiting to start your program, enjoy your summer, enjoy your time off, because it's going to take all your time. Yeah. And then for those of you who are like me in class in the summer while everyone is out and about, you can do it. Hang in there and push through. Yes. And then for those of you who are like me, have senioritis and almost done and checking out, again, you can do it because I'm
She's doing it. That's why. Yeah, she's proof.
Just keep going. What's that? The Nike line? Just do it.
Yeah, just do it.
Just do it.
And
then you'll
Dory
get
says, just keep swimming. Yes. Yeah. So just keep
swimming.
Going. One day at a time. Yes. With my MBA program, yes. I just passed my last class before the capstone. Yay. So I just like you, I literally for the whole entire June did not want to do anything. I had like Jonas Brothers every weekend and I had a concert to go to. And like, I was just so busy that with school, I was just like, oh my gosh, I'm just pushing it back. But I finally like kind of buckled down and I studied for a good 2 weeks and then passed that class, which was really exciting.
And that's economics, right?
Yeah. Yeah. Remember when we were talking about it? I was like, I don't know anything about economics, but once you sit down and actually focus, you can learn a lot really fast. So I think that's something. And one thing I recommend doing is like, if you're really stuck, like turn your phone off or like, don't go on it. Cause I told my boyfriend, I was like, can you make sure I don't go on my phone? Cause it's very distracting, so that helped. But now I have one more class left before I finish.
So and that's a very big class, right?
Yeah, capstone. So I guess it's like 4 different tasks and you have to write a huge paper and you have to send in a video because it's like you're preparing for your own type of business project, basically. So we'll see how it goes and I'll update you guys. But I'm excited for it, more so because it's toward the end, but I'm also worried that I'm going to have that, like, I'm at the end, so I don't want to push as hard.
You're going to push it or postpone it later and later like you did with the last class?
Yeah, like it could go either way, but that's where I'm at. And I mean, it's summertime, so trying to enjoy life as much as we can too, even though it's been pretty crazy. So yeah, hopefully you guys are all doing well and just sticking through and not giving up, because if you can see it, like everyone's in the same boat, really.
Yeah.
We're all just trying to get through. So, but yeah, today, hopefully you guys are gonna enjoy this episode. For those who don't know much about sonography or are going into it, or are curious about it, we're going to dive deep into general sonography and answer your question, which is, what is general sonography? And that's just basically what is like ultrasound in general. But the term for doing ultrasound is sonography, and the group is called general. For those who don't know ultrasound, it's just called general sonography. And Lynn here has a definition for you. If you Google sonography, general sonography, what do you get?
So what is general sonography? General sonography covers ultrasound imaging in obstetrics and gynecology, evaluation of the abdomen, thyroid, scrotum, prostate, neurosonography, and breasts.
Yeah, so she
Am I missing anything else?
I mean, that's pretty much the general gist of it.
That's all the specialties under general, right?
Mm-hmm. So if you want to become a sonographer, a general sonographer, a registered diagnostic medical sonographer, which is RDMS, those are the things that you could get registered in, basically. So if you go onto ardms.org and you click on that RDMS tab, which gives you the options of what kind of, registered sonographer or ultrasound technologist, for those of you who don't know, they're like, the definitions we get called. You can get registered in abdomen, breast, OBGYN, and pediatric sonography. So under that tab also says fetal echo. So I'm assuming that's also part of it. Echo is a whole nother story we'll talk about in the future, but they have that under that tab for some reason. So
because
there must be a reason.
It ties in with OB and PD, mostly OP, fetal echo, right? Yes. Yeah. So it ties in with OB.
Yeah. So, I wonder, so can I take it?
You can, yes.
Oh, cool. Wow. Well, I don't scan fetal echo in general, but in general, you can scan all of that because it's part of OBGYN, which is what Lynn is saying. So today, we're going to talk about all of those exams a little bit more in depth. I am a general sonographer. Lynn is an echovascular student. So
but I am learning general right now.
But I am actually learning general. Yes. And what did she just do this past? What happened on your test?
Oh, I got a 96 on my OB midterm. Yay. And a 94 on my abdomen midterm.
Good job. See, echovascular and abdomen.
So maybe I can do general and OB too, but I don't know.
Yeah, maybe.
I like OB.
That's good. I'm glad that you like it. I don't. But, I have to scan them. The thing is that if you're so lucky to go to school like Lynn that teaches everything, that would be very ideal if that's something you're interested in, so kind of do your research and see if they offer all of the modalities. So all of the general and echo and vascular, which is really cool. Mine only taught general. So that's why I'm in general. But did you like learning about abdomen and OBGYN? Was it weird because you were doing echovascular this whole time around?
It's not weird at all, but because or at least I have the echo and vascular information as a background, like abdomen comes easier than OB, because all the vasculature, and now we're just taking it in a different point of view. And then OB is like a whole another field. So it's really fascinating. My program, they teaches you everything. And then with some of my classmates, and I'm sure like other students as well, who came into this program wanting only to do echo and vascular or just general and don't want to do the other track, they kind of get like, I don't want to do this one. Why do we have to do this one? You know? So sometimes it's kind of like depending on how you see it.
Yeah.
And, even though there are times I'm like, I'm ready to take my echo and vascular, and I don't know if I can continue with abdomen and OB, but I do appreciate the opportunity to learn this general track. And I don't know, maybe I'll scan them in the future. I don't know.
Yeah, and that's good because a lot of times that's a good way to see it though, because some people, they know they don't want to do echovascular. So you can kind of just go to a school that only offers general or general and vascular. So my school taught general and vascular included with that, because out here in Las Vegas, all of the departments, all of the hospitals, and most of the outpatient places, they do general and vascular. So we do all of that stuff, abdomen, breast, OBGYN, pediatrics, and we do vascular. And out here in Vegas, echo is its own department. So echo is completely separate. And that's different in all different cities. So just make sure you're doing your research as always. But I'll kind of go into what I learned in my program first and how we were structured. And what happened was they taught us vascular first. So we could, that's kind of like the easier protocol. If obviously venous is, right? And we'll talk about that in the future when we dive deep into vascular. But we learned vascular first. We learned how to do legs first. And then after that, we got to do abdomen. So I'll dive more into abdomen, but abdomen ultrasounds, we do them because patients have like abdominal pain or abnormal blood work. So they'll say like elevated liver function tests or elevated kidney enzymes or elevated white blood cells. So, any sort of anything with too much increased or even too low, like abnormal lab values. Do they teach you that in school? Because
not yet.
I was gonna say they didn't teach us that really in lab, but we just kind of learned how to scan. But they teach you, the reasons why you're doing these exams for like abdomen. The most common one is like abdominal pain, obviously, and the abdominal cavity includes a lot of organs because our bodies are built up with so many different things and so many different things come together. So we have to, under ultrasound, look at all of them. And so they created this protocol, and in ultrasound, you do protocols to do your exam. When you guys go to school, for those who aren't in it yet, you will learn the protocols. And these are basically the images you're going to take for every organ that you are examining, and you are the doctor's eyes. So you are making sure you're getting all of the images for the doctor that they need. So 1, we have a reason for this exam. 2, we need to set out the protocol and make sure we get all the images for the doctor so they can, take a sweep through of everything in the body and see what's going on. So abdomen consists of the pancreas, the aorta and IVC, which are the vessels of the heart, and then the liver, gallbladder, the common bile duct, the kidneys, right and left kidneys, and the spleen. Did I miss anything? And it doesn't seem like that much, but it's a lot. That's part of our protocol. I don't know do you guys do the CBD and all that stuff? Yeah, like CBD, gallbladder.
I'm learning it.
You're learning all that stuff? Yeah.
Yes.
So it's all of that. It's like the biliary system. It's all the different systems inside the abdomen. And we have to make sure that everything looks good. And what our job is as a general sonographer is to make sure we're getting all the images in our protocol and make sure that we're not missing anything. There's a lot of benign which means non-cancerous things you can find on people's kidneys, gallbladders, liver, like cysts and things like that you learn about. And they're normal. It's just there. And so you'll have to take pictures and document all that stuff. Abdomen is actually quite, I feel like it's daunting at first because there's so many organs and so much pathology. And that's the one question I think everyone asks me, like, how do you study for abdomen? Because there's so much stuff. But I think if you just kind of organize it to each organ, you can, understand it a little bit better. But yeah, that's abdomen. And there's a lot of different things we could do with ultrasound, like procedures. We can go in there and do biopsies, take some tissue samples, or even drain some fluid from the abdomen. And yeah, that's pretty much abdomen. Is there anything that you have any questions about abdomen? It's just, belly.
It's a lot. Yeah, it's the belly.
Yeah. Like kidney stones.
Mm-hmm.
It's just in general, that the one exam I think that's very popular in the ER.
General?
Mm-hmm.
Or
I feel like
are you talking
like
about
abdomen.
specific like organ?
Yeah, like abdomen is very popular because people come in for vomiting, like nausea, vomiting, diarrhea. Like,
so what studies would you do for like patients with that symptoms?
Yeah, so nausea, vomiting, diarrhea, or like abdomen pain. It would be usually an abdomen complete where you look at the entire abdomen because they're trying to rule out gallbladder stuff or kidney stuff. Or a right upper quadrant, which includes everything on the right side and not this left kidney or the spleen. Like they're like, I don't care about the left kidney or spleen. I want to see everything on the right side of the body. Some places include pancreas. We include the pancreas. But yeah, for abdomen, you're just doing the entire abdominal cavity. And for pediatrics, it's a little bit different because you add the bladder in with that scan. You can also do like a dedicated kidney exam if it's just for flank pain on your sides, or for kidney stones, or hematuria, which is blood in your urine, or dysuria, which is pain when you pee. And you learn all these things in medical terminology, but there's dedicated exams where you can just do just the gallbladder or just the kidneys or the whole entire abdomen. And most doctors are like, let's just do the whole entire abdomen, but that's mostly one of the popular things that people become registered in is abdomen in general sonography. Like they'll do an abdomen registry and become registered in that. Now, to become an RDMS, you need to just be registered in one specialty. And then you can get registered in multiple specialties if you want. But just because you're registered in abdomen doesn't mean you're not going to scan OBGYN as a general sonographer. So the next type of exam we'll talk about is OBGYN. And Lynn is currently learning all that good stuff and is liking it, which for me, I didn't like it because it was the last thing I learned in clinicals. So I had a very hard time with it. But OBGYN includes obviously early pregnancy, which is like before 6 weeks, first trimester, second and third trimester. And each span of the pregnancy, you're going to have different types of protocols. And the pregnancies sometimes will include the ovaries, but not always. Like if you're in second and third trimester, the baby gets so big and your uterus gets so big that you usually can't really see the ovaries. But in the beginning stages of pregnancy, you'll see the ovaries. So OBGYN is a huge,
specialty.
Yeah, specialty in general, because you can do a lot of different exams with that, including the pelvis exam. So the pelvic exam, if you're not pregnant, then you're just looking at the ovaries and the uterus and the cervix. Now with OBGYN, you can scan on top of the belly, or you can do endovaginal, or that's the internal exam, which we call transvaginal. And that's where the probe goes through the vaginal canal. And that's a very, very common exam too. Lots of patients come to the hospital or to outpatient for like abnormal periods or abnormal bleeding or symptoms of PCOS. You can have pelvic pain, there's infections, and there's a lot of other things, even vomiting and like excruciating like pelvic pain. That's probably the most common thing that people do pelvic ultrasounds. But you guys will learn also the reasons why people get these exams in school. It's just OBGYN is another part that you have to learn. That's, remember, we're doing the whole entire body for general sonography and you have to know everything. So it seems like a lot, and it is, but it's doable because obviously we're all doing it. We're all capable of scanning any type of organ that a doctor gives us, you know? So OBGYN is really cool. And I think if I really wanted to practice more and do more, then maybe I would get better at it. But it's not very common for us to do second and third trimesters in my hospital. But we will go into deeper depth in the future with OBGYN because we wanted to put that in its own thing as well because it's such a big deal. And then after OBGYN, we have thyroid, you said, and then scrotum. Those are like
superficial structures.
Superficial structures, musculoskeletal, things like that. Have you scanned any of those in school? No.
So with our program, we instead of scanning superficial structures, we have Echo 3. So their general track, instead of having Echo 3, they have superficial structures.
Okay.
But in lab, I did play with the phantoms, which is, in case you guys don't know, it's like a mannequin, a model mannequin where we can practice scanning. And I scanned the prostate. I scanned it trans-abdominally. So I put the probe on top of the stomach, even though it is a transrectum. Was a phantom.
That's cool. See, I wish we had that. But we don't have that. So we didn't get to learn that stuff until in clinicals. But at least you get to see them. Yeah, prostate. People don't know we scan prostates. That's also included in your abdomen registry. So if you are planning on taking the abdomen registry, make sure you study prostate too, because it's such something that we don't really look at all the time. Mm-hmm. It's usually an incidental finding, but you can usually see it on a male pelvis if you're scanning the bladder area. So, prostate, thyroid, and then we can basically scan anywhere along the body for like masses, lymph nodes, bumps, lumps, fluid collections, abscesses, things like that. So if a patient came in with like swelling on their neck, we would do like a neck protocol and take a look at the neck because you can have lymph nodes that are enlarged all over your body, even in your groin, basically anywhere. So if they're like, hey, there's like a swollen cheek, like you'll scan the cheek because there's a parotid gland right there. And you can basically see what's going on with the soft tissue. And that's very important because ultrasound is no radiation and it's pretty easy to do, like, hey, let's just get an ultrasound real quick and look at your cheek and see what's going on. So that the ultrasound to do soft tissue is very, very fabulous. It's probably the best thing to do for your first type of exam. And then if they really need more imaging and to look at it a little bit better, then they'll probably order a CAT scan or an MRI to get more detailed and things like that. But ultrasound's really good for superficial stuff, especially if it's really close to the surface. Because what we learn in physics is if it's really close to the camera, it's better quality. If it goes deeper into the body, do all your physics stuff to make it look a little bit better. And you'll learn that in school. But superficial structures, those are really good to do ultrasound with, and we do that in general. So Lynn won't have to do any of that when she does echovascular. Nope.
the most I would do is probably the thyroid with the carotid.
Yeah, maybe she'll see some incidental findings. So the thyroid, obviously, it's usually has to do with labs, like elevated labs or decreased lab values. Hypothyroidism, hyperthyroidism, if there's a lump in your neck, if you're having difficulty swallowing. things like that. But yeah, general sonography includes everything in your body. And it does include the vascular system for many places, but we will dive deeper into vascular in the future. And yeah, all of this stuff, you have to learn all this stuff in order to be able to do pediatrics. So, pediatrics is the whole entire general, it's everything in general. And then also looking at a baby's like bowel system. So we check for like intussusception, which is where the intestines kind of like telescope on one another. So like, they kind of like get stuck and then there's like an obstruction in there and it's really weird looking on ultrasound, but you can find it really well on ultrasound. So a lot of pediatric exams, they will gear towards ultrasound. So if you guys like kids and scanning, wanting to scan kids, go into pediatrics because it's really cool to see. You'll get a lot of ultrasound exams with pediatrics. We do baby hips, we do baby spines, we do baby stomachs. So there's this muscle that we have that connects to our stomach, which is called the pylorus muscle. And we see if it gets thicker. And that's what creates projectile vomiting on a baby. So a lot of times when babies come in for like a lot of vomiting, we'll scan their muscle to see like if there's a stenosis or basically like a blockage or the muscle is thickened. So they're not getting the food into their stomach and they're just vomiting it out of their mouth. So some of the parents will be like, oh, our baby's vomiting like the exorcist or something,
Oh my gosh.
Yeah, isn't that crazy?
Yeah.
But then you're like, oh, okay, yeah, it's probably positive, because if it's like, wow, that's usually the sign of a pyloric stenosis. But there's a bunch of other things we do in pediatrics that deals with the bowels, and everything we do on an adult, we do on a pediatrics.
Is that why we have to learn adult first? So that we can go into pediatrics?
Yes, and that's why it's its own thing, because there's so many things you can learn about pediatrics. I mean, when I had to take the pediatric registry, I was like, oh my gosh, it's a lot, which is just like normal adult stuff, but now for kids, because then you have to learn the different stages of life as a kid, like when they're just out of the womb as a neonatal baby, and then when they're a little toddler, and then when they're like child, and then when they're a teen, like there's just this whole span of life that we have to know. And as a sonographer, I'm just amazed at the amount of information I know. You know what I'm saying? And I'm sure you're amazed too, like knowing all the things you do with echovascular. But it's good to know everything in adults first and then learn pediatrics. And that's the whole premise of it. Is a lot of people are like, oh, I want to do pediatrics. Well, you still have to learn the whole thing in general. Oh, I want to do OBGYN. Oh, you still have to learn the whole thing, abdomen, OBGYN, and small parts, Also, breast is part of all of that. So breast it's one of the more, they say, easier registries to get because it's just focused on the breast. But obviously, we do breast just like superficial stuff. We just kind of look for lumps, bumps, breast pain, abscesses, things like that. Breast tissue. Breast is very, very specialized, and we don't do it in the hospital setting unless it's just for abscess. We'll scan breast in outpatient settings. It's an outpatient exam because you have to have usually a mammo with it, because ultrasound is not the best modality for breast. It's just helpful for mammo as well. But we do scan it as well in the general sonography. So Lynn does not have to scan breast. If you don't want to scan breast, if you don't want to scan OBGYN, and you don't want to scan pregnancies or like vaginal bleeding, if you don't want to do T-vages, if you don't want to do prostates, if you don't want to do any of that stuff, you don't have to. You can go into echovascular.
You can.
Yeah. So, but that's just ultrasound in general. And hopefully that was a pretty good dive into general sonography. What do you think?
I think that was very, very informative. I think it's really good. Like, I was just thinking when you were saying this, like, if only I have this much information when I was applying to my program. I was like, what is general sonography? I think you summed it up really, really well. quick question.
Mhm.
Would you consider neurosonography in your
Oh, yeah.
general as well? Because
So,
I know the RDMS doesn't do neuro
yeah,
anymore. So
yeah,
where do you think that what ties into, like
that's a great
vascular
question.
or general?
So I appreciate you bringing that up because I totally forgot about it. They did put that in the definition, but it's on ARDMS where it says neurosonology registrant. And back in the day, you would take a neuro exam to become registered in neuro. Now, the only thing that is in neuro are transcranial Dopplers or TCDs. And that's actually a vascular type of scan. So that's the scan in the brain. Neurosonography is the scan of your brain. And it's a very tedious exam. And you don't want to do it unless you actually know what you're doing, because this is very, very, I guess you could say, like, you need a lot of skill to know and make sure you're looking at the right vessels in the brain, because everything's so tiny. It's like millimeters, and one movement off your window, you're gone. Like, it's a very difficult exam, but I think that it is technically part of general vascular. Now, I only say that because neurosonography is usually only done in an ICU setting, or in like a hospital setting. I don't know if they do them in outpatient, because all the outpatient places I've ever worked at never did TCDs. And so, I see other hospitals that do them. But if you're at a place where they specialize in TCDs, you're usually a general / vascular sonographer. Now, do they do that at your hospital or where you were learning?
So I've seen TCDs at outpatient, which is in a cardiologist's practice. And the hospital that I was at, the only department that does TCD is the general department. So it's like really depends on where you are, what or how, the facility is run. And I do agree with you that TCD is mostly vascular, because, and it's really, really difficult, because when I was learning it, you only have these windows and you can't really see, you can't really put a probe on your head and see arteries and veins. You just have to know the depth of where it is in the brain to know what arteries it is. So it is difficult. It is very, very fascinating.
Yeah.
But you just got to have years to know everything.
Yeah, I think if you're a new grad, TCDs will be very difficult if you didn't get training in them. So you need to get trained in them. I've seen students who are getting the certificates and they're being trained from actual people who do the TCD training, and they train them, they get certificates. For us, we have only a few people in our hospital that really know how to do TCDs, and they train each other. We train people who want to learn TCDs because it's such a tedious exam. We do them every day. You scan patients for at least 14 days straight in a row, sometimes up to 3 weeks, 4 weeks, just to make sure their brain, is okay, because you can have vasospasm, which is like elevation of the velocities, and it goes up and down within 24 hours, and it can get really confusing. So it's very important that you get trained in it well. But that's a good question, because a lot of people who ask me, like, I want to do neurosonography, what do I do? It kind of depends on where you live. And you just have to get trained in it by someone. I don't think, because like in school, in my program, they didn't teach us TCDs. Like, I learned that on the job. And I think many places, a lot of things you'll have to learn will be on the job. And that's good too, though. It's like, it's good to know, even if you graduate and you don't learn it, you can still learn it down the line. So definitely, if you guys are still looking into programs and things like that, do your research and figure out where in your city or town you can do neurosonography. And I'm sure with Facebook groups, with social media nowadays, you guys can do all the research, asking around, hey, where can I do this? Where can I do that? And that'll probably be your best premise on where to start. It's just for anything in general. So, but yeah, hopefully you guys enjoyed today's episode.
Yes. And if after this episode you find that general is not for you, stay tuned to our future episode because we will dive into ecovascular OB. I believe that's all we're doing. Are we doing other specialties as well, or just doing the big ones?
We're doing the big ones for now, and then eventually.
And if you guys request MSK and midwife and stuff, definitely work on that for you.
Yeah, we kind of just like hit the big stuff, right? And I think neurosonography, like MSK, and midwife, all those things, like they're a little bit more smaller in ultrasound, but they are there. We don't want to like, say they're not, but they are. It's just not as big as abdomen and OBGYN. So yeah, just know that if you want to go into any of those things, you have to learn all that stuff. You have to learn all of it. So
you have to learn all the big specialties first: general, ecovascular, OB. So that's what we are trying to do with this episode and our future episodes, is to dive in depth with each of the specialties so that you know what specialties you want to go in. And hopefully these episodes will help you.
Yeah. So until next week, well, we're going to have a guest on, hopefully, and you guys will learn a little bit about them.
Yes, and see how their lives are as an RDMS. And before we go, if you haven't had a chance, please, if you're watching this, comment, like, subscribe to Giselle's YouTube channel for more future episodes. And what else? Apple and Spotify podcasts, if you are listening, please set your notifications. And if you can, rate us 5 stars, because we do read them. We do check them to see. It's just like a way for us to measure how we're doing, and so that we can do better for you.
Yeah, we appreciate it. Thank you guys for listening, and we'll see you next time. Bye.